Hello and welcome to part 4 of our 5-part series on ileostomies. My name is Sophia and I'm one of the ostomy nurses that works here at Dartmouth-Hitchcock. In this section, we'll learn about dehydration. Obstruction and dehydration are the two most common setbacks after surgery and can lead to prolonged hospital course or readmission after discharge. In the last section, we talked about obstruction. In this section, we will talk about dehydration. If you're dehydrated, you're going to feel thirsty and dizzy, and you may have muscle cramps and dark urine. Dehydration is usually due to high ileostomy output. And when we say high ileostomy output, we mean greater than 1.2 liters of ostomy output in 24 hours. Additionally, your large intestine isn't available to absorb fluids, so you are at an increased risk for dehydration after surgery. Your small bowel hasn't learned to take over yet. The first step to prevent dehydration is to track your intake and output and monitor that trend. So we can see in this chart here that the recommended maximum ostomy output in 24 hours is 1.2 liters or 1,200 milliliters. And in 12 hours, it's 600 milliliters. In 6 hours, it's 300 milliliters, and so on. This is just a guideline to be aware of to see if you are at risk for high ileostomy output and dehydration. As just discussed, tracking your intake and output is the first step to preventing dehydration. However, if you do have high ileostomy output, our goal is to thicken up your poop and slow it down. And we achieve this goal through a stepwise process by first advancing your diet and then adding anti-motility agents such as fiber and Imodium. There are several foods that will thicken up your poop naturally. For example, the brat diet, which is bananas, rice, applesauce, and toast. Additionally, creamy peanut butter, cheese, mashed potatoes, whole wheat or white pasta, and potato chips are all foods that will thicken up your poop naturally. You will be provided this list again when you are in the hospital after surgery. I'd also like to mention that some foods you eat may change the color of your poop. For example, beets, V8 juice, and Gatorade may all make your poop look red. If we have optimized your diet and you're still putting out more than 1.2 liters of ileostomy output over 24 hours, then we will thicken your poop with fiber and Imodium. The fiber we use is called psyllium, also known as Metamucil. This is a soluble fiber, so it acts like a sponge, versus the insoluble fiber like raw carrots or broccoli that will give you an obstruction after surgery. The fiber comes in a powder, or metafiber wafers, which are like cookies, are also an option. The packaging the fiber comes in often says to mix a dose with 8 ounces of water. However, we do not want you to follow these instructions. We are trying to thicken your output, so we request that you mix the recommended dose of fiber with 4 ounces of water. Imodium, also known as loperamide, is an over-the-counter antidiarrheal that will slow the motility of your bowel. You can take 1 to 2 tablets 2 to 4 times per day. The second step to prevent dehydration is to make sure that you're staying hydrated. It is important to drink 8 8-ounce glasses or 64 ounces of hydrating fluid per day. It is also important to replace the electrolytes that you are losing through your ileostomy. We do this by having you drink something called an oral rehydration solution. We have you start this in the hospital and continue it after discharge. Additionally, you should drink most of your liquids with your meals and snacks and limit what you drink in between. This will help slow down your ileostomy output. Your team may elect to discharge you with a PICC line in place so that you can receive 1 to 2 liters of IV fluid per day after discharge. On average, IV hydration often lasts 1 to 2 weeks, at which time your body has usually adapted to your new ileostomy and your 24-hour ostomy output normalizes to an acceptable volume. It is very important to find a balance. You will need to adjust your fiber and Imodium intake depending on your ileostomy output. A potential result of taking scheduled fiber and Imodium without paying attention to your ileostomy output may be an obstruction. And commonly, after experiencing a post-operative obstruction, the pendulum can swing and you may experience high ileostomy output. Remember, your large intestine drinks for you and it is no longer connected. Your small intestine will slowly start to take over the role of your large intestine and will start to absorb water and fluids. Adjustments are happening inside of your body, so you need to make adjustments outside of your body. We understand this can be very overwhelming after discharge, so please do not hesitate to call us with any questions. Thank you for watching, and please visit our other ileostomy videos.